Good morning, my beautiful people. I'm Dr. Nikish, and welcome back to my YouTube channel. Recently, my best friend just had a new baby. Congratulations. And with me being in the medical field, she had a lot of questions for me about epidurals and what to expect from anesthesia when going in to have a baby. So I decided, that's a good topic for a video that a lot of people may have questions. So what is an epidural? Okay, guys. So essentially an epidural is a potential space that you have in your back by your spine. So when you go in for labor, your anesthesiologist will assess your anatomy. So they'll feel on your back to find the interspaces between the bones in your back. And so essentially, to make it easier to place an epidural is really about positioning. So the better you're able to curl that spine around that baby, kind of like the letter C, or sometimes we describe it as a shrimp, helps to open up the spaces in between all those bones in the back so that the anesthesiologist can get into the right space. And so some things that may make it difficult to place an epidural will be sometimes if people have a little bit of curvature or scoliosis of the spine, because then it can kind of not have a straight path. It may course a little bit over to the side, which may make it very challenging to get into that space. Another thing that people don't consider is your weight. So the placement of epidural is all about feeling anatomical landmarks. So for patients that are a little bit on the heavier side, the space from the skin to the bones in the back may be very difficult to feel exactly where you are, which can make it a little bit more challenging to get into that space. So on average, the distance between the skin and the epidural space can be anywhere from as shallow as 4 centimeters. I would say most often in my practice, I find that space usually around 6 centimeters deep to the epidural space. But some people may be 7, 8, 13 centimeters deep. I wish I had, next time I'm gonna get a measurement to just kind of explain to you guys, how far away that space can be. I did find a little picture online to kind of illustrate the difference between an epidural and a spinal. And so technically placing them is very, very similar, but you're getting into slightly different anatomical space. So if you look here on this little picture that I have, you'll see here is the bone. This represents the bone that you're feeling, and this is the skin that you have to course through. And these would be the inner spaces. So when you're placing an epidural, you're getting in the space that's right outside of where the spinal cord sits. And all this blue stuff represents the cerebral spinal fluid, or the fluid that bathes the spinal cord, and that fluid goes all the way up to the brain. And this represents the spinal needle going directly, putting medicine directly into that space. And so in the epidural space, this is depicting where the needle goes, and then there's a catheter that's left in that space. I have one more depiction that kind of shows, I feel, a little bit better of the inner spaces, trying to get in between those spaces. So it's a very, very small space that we're trying to get into, and the feel is all based on technique. And so obviously that's gonna vary from person to person, which can make that placement a little bit more challenging to do. So when you have an epidural placed, the medicine that we put in that space is essentially a combination of a local anesthetic as well as a narcotic. And the reason why those are typically combined is because if you do a higher concentration of local anesthetic, the more weak you will become. So it's gonna be a little bit harder for you to squeeze, to push that baby out when it's time for delivery if the concentration of local anesthetic is very, very dense. So trying to get a nice balance, a lot of time a narcotic is added to give you a little bit better pain control without causing the same level of weakness. Let's see. So what are the side effects of epidural? Most often people can sometimes complain about a little bit of itching, and usually that's associated if there's any narcotic in your epidural, which is pretty common. And the side effects that go along with narcotics besides itching can be nausea or vomiting. Some of the risks that accompany placement of an epidural include low blood pressure. So as an epidural starts to work, it will put what we call the sympathetic nerves to sleep essentially. And those are the ones that give you a lot of vascular tone. So it can actually be helpful for some people that come in that have really, really high blood pressure. It kind of will help to lower that, but sometimes it can lower the blood pressure too much. And so because of that, a lot of times we will give a fluid bolus to try to counteract those profound, rapid blood pressure lowering effects. It can also cause soreness at the site after that's removed. And then of course, anytime you're putting a needle in the back where there's nerves, there's risk of injuring nerves or vessels that are back there where that needle is being manipulated. One thing that a lot of people don't realize is it's very important that your coagulation status is normal before an epidural or a spinal technique is placed. So oftentimes we will check platelets and make sure that our patients are not on blood thinners, because since that space is deep and you're coursing through muscles and you may hit small vessels, if you get in a situation where you start bleeding into that space, it's very, very difficult to compress that space to stop the bleeding. And so therefore you can develop a large, what we call hematoma in that space that can actually compress the spine or nerves, which can lead to long-term damage. So we always want to make sure that the platelets are normal and your coagulation status is normal, so that we don't have to worry about things like that happening. By and large, majority of epidurals are really low risk, but those are things that you need to consider. And so it's a great option for pain control, but realize there are some situations in which it may not be safe to place an epidural. If there are any other questions that I didn't answer about placing an epidural, please comment down below and I will try to answer them by either commenting or updating this video with responses to those questions. All right, thanks guys. Have a good day.